Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and as you know, if you follow our YouTube channel, we do a lot of product reviews, and it gives me pleasure today to talk about Restylane, Refyne, and Defyne. And I think I'm one of the first people in the state to use this, but I won't be the last because I think this is a really exciting group of fillers. So in the past, when we were using fillers, we really had, for a while, we just had one filler, then a second FDA filler, and we had one filler that you would put everywhere. And as things got more refined and the biochemical properties of these things became refined, then we had more versatile fillers, and we had some fillers that were more specific, okay? And you know, you have appetizers, you have main courses, and you have desserts. Now, every year, we're seeing new and more versatile fillers that do specific things. So what is going to happen is that all the filler companies, we're talking about the Restylane brand today from Galderma, but all the filler companies, like they have been in Europe for a long time, will have specific fillers for specific indications. And it's really great for injectors because it's kind of these are boutique fillers that have specialized uses in areas. So we have, for instance, with Restylane, you have Restylane Fine Line for your very superficial lines and wrinkles. You have traditional Restylane, which is a workhorse filler and can be used for many purposes. You have Restylane Lift, which used to be Perlane, which is for cheeks or areas where you need a lot more lifting. And now we have two more choices in the Galderma line of fillers. We have Restylane Refyne and Restylane Defyne. And without getting into a lot of chemistry and physics, cross-linking is a treatment that is done to the hyaluronic acid. Hyaluronic acid is a gel that's found in our body normally, and if you just injected pure hyaluronic acid, it would be dissolved overnight. However, these companies cross-link these, and that gives them their properties. So Restylane Defyne is a thicker filler for deeper wrinkles. You remember the D for deeper. And Restylane Refyne is a more flexible fluid filler for moderate, or I would say moderate applications. And these are cross-linked a lot more than other fillers. They're up to 6 or 8% of cross-linking, which is a lot. And also these particles are pushed through grids to get a more uniform particle size. There's a lot of chemistry that happens behind the scene to make these fillers this specific for specific areas. So this company has now 5 fillers for specific applications, and you're going to see this from all the companies, but it's very exciting. And my staff and I were really happy to get this in our hands, and we're going to show you some injections. And I'm Dr. Joe Niamtu, LoveThatFace.com. So we're using Restylane Refyne, and these are the new cross-link fillers, and this is really part of the exciting technology that you're going to see from filler companies, and Restylane has certainly jumped on this bandwagon, and my European colleagues have had the advantage of using these types of what I would call boutique or customizable fillers for a long time, and this is brand new. I think this is probably one of the first injections here in Virginia, but I promise you it won't be the last, because these products are going to be very nice, and they are touted to shine in areas where you have a lot of movement and you have natural expression. It doesn't break up the cross-linking and doesn't look lumpy, but rather moves with the patient, and that type of cross-linking probably keeps it from breaking down as quickly, but it makes everything move with expressions in a natural manner, and I think that's one of the shining stars of Restylane Refyne, and we'll talk about Restylane Defyne. So in terms of Galderma's products, Restylane, we have Restylane Silk, we have the traditional Restylane, we have Restylane Lift, which was formerly Perlane, and now we have these 2 other additions. And it's a very natural injecting type filler, and it does quite well. Open for me. And filler treatment is just going to get more and more exciting as fillers become more versatile. We have more selections, close a second, and they last longer. Open for me. And we'll come back in a minute and use some of the Restylane Defyne. And now we're going to use Restylane Defyne, and the D is for deep, okay? So this is placed a little deeper and has a little bit more filling and lifting capacity, and you would use this. Where we use the Refyne in a very superficial area, I would use the Defyne more for nasolabial folds. And again, you know, just because there's a certain name and it's supposed to go in a certain place, I mean, experienced injectors will be able to pick this stuff up and do magic with it, just like a cook may not need a recipe. They'll just mix something up, whereas a beginner would need to use a specific recipe. So we're going to inject here and sort of subcutaneous. This patient has a little bit of a indentation here. And we're going to fill that very gently. And we'll put a little Vaseline on there and massage that. It feels great and it flows really nicely. Now we're going to move to the nasolabial folds, and this patient doesn't have real deep folds, so we'll just use a little bit in each side. And again, the D is for deep. You can just see this inflate the fold, and that's important for novice injectors. You need to be able to see your correction as you're doing it, because it doesn't get better later. It's what you see is what you get. And if you ever see the filler migrating out this way, you have to stop and inject more immediately. Otherwise, you can create a bump there and actually make the patient look worse. Open for me. We'll do a little bit of massage here. And then we'll go over finally to this side and open. And again, this patient keeps up on filler and just doesn't need that much, just a little top off or touch up. So this are the latest fillers to be FDA approved, and different formulations, different linking, meant for different, we're getting a little swollen right here. And these are meant for specific areas and specific applications, and it just increases our ability to use fillers and make them more versatile. I'm Dr. Joe Niamtu, lovethatface.com.